And we are back. We're back home. It has been a harrowing 10 days. My daughter, during an ultrasound, it was discovered that my daughter probably had a double ureter system, which that is, your kidneys have tubes, ureters, that go down to the bladder. Well, she had a duplicated system on one side. She had two ureters, which is not terribly common, but it's not terribly uncommon. You could be walking around with one now. The problem is that it could cause urinary tract infections and some kidney issues later in life. Some bladder issues also. So what happens is there's some reflux. Some urine is getting refluxed, recycled back up into the kidney. So we monitored it. And then after she was born, about 6 weeks after she was born, I said, you know, she's pushing really hard to go to the bathroom. Little baby, she's pushing really hard, more than she should. Not a lot of people listened to me, and she ended up pushing her bladder out of her body. Now that is rare. So we made the trip to Riley's, the 4-hour trip to Riley's, and they were able to fix it up there. They couldn't fix it here. So they said, we have to watch it. We may have to do some surgery. Well, earlier this year, when she was a little over a year old, had some more scans, and it ended up being that the doctor said, yeah, we need to remove the ureter, the duplicated one. We actually repositioned the ureters on the bladder, and maybe some reconstructive surgery. And I'm like, that's a lot. So there's an element of trust there. You have to trust what the experts, and this was, you know, a literal expert in urology. And so we had the surgery last week. As I stated before I left the hospital, or in England and Australia, what they say before they left hospital. It's been difficult. My daughter's been in a lot of pain. She's been on several medications, and who wants to see their child in pain? She's been on, ibuprofen, acetaminophen, the proper dosage of Valium to calm her down, which had the opposite effect, because children can have the opposite effect of certain medications. Her mother has that too sometimes, but you never know. So no more of that. But then they had I guess you could call it a anti-spasm medication, and those, we came to find out, made her dehydrated to where she was achy. It didn't feel good. It's been really difficult. And just today, and a little while yesterday, it seemed like we got our baby back. The one that before the surgery that was all happy, and I hope the surgery was worth it. It would. We won't know. Hopefully there's no complications. But anyway, that's why I have been busy with care for my daughter. We tend to take stuff for granted, don't we? So, hopefully it looks like everything is getting back to normal. Hopefully better than normal. She didn't really have any issues in the past. This was preventive surgery. So, I think everything's going to be okay. It looks like it now. Everything's going to be okay. But it was very concerning. And maybe this is the last hurdle we have to have in several areas in my life. I make these videos because I enjoy it. You know, it's a bit of therapy to me. Like other things, you know, we all do in our lives. It's an escape. It's therapeutic. Sometimes I'll draw a picture, and after a few minutes I'll look up after drawing a picture, and what was maybe bothering me in the back of my mind previously doesn't bother me as much. I mean, it takes you out of the situation for a brief moment so you can compose yourself, you know, regather yourself, get some, regain some perspective. So, and of course, I was talking about our favorite franchises, and like these videos and other things that we do, these franchises are pure escape. And we shouldn't forget that, because our escapism is supposed to be entertainment. It's supposed to be enjoyable, you know. We don't want a lot of politics or overloaded with social justice, etc. We just want good content that fulfills the escapism that we all search for. You know, when the Greeks started having public plays, it caught on, and it's lasted since then. You know, it's escapism. It's supposed to be entertainment. You give what the people who want to experience that escapism what they want. It's really that simple. But money, arrogance, and agendas get involved. Wouldn't you agree? Thanks for watching, and I'll start making some more videos. Enjoy the journey.